the team on a fairly functional split. So I was the operational manager responsible for all of the assessments across the 0 to 25 age range, and Poppy Tuck, my counterpart, was responsible for all of the annual reviews that came into the team, again across that whole age range. And that's been a really positive and successful approach for us. It's really helped us to work with wider SEND partners and think about timeliness and how we can improve timeliness and make sure particularly those assessments are completed in that statutory timescale. So great progress is being made there. What we want to do now is, while sustaining those improvements in timeliness, is we want to think about how we can link things up and have a better experience really for families going through the statutory processes and for schools as well. So with that in mind, we've tweaked things slightly, and I am the operational manager now for all of the assessments and all of the reviews that take place for the age range from the early years children up to those in year 8. And Poppy Tuck is responsible for, again, assessments and reviews for all of the children and young people who are in year 9 and above. So we will now start to build upon the processes we've developed, but also develop that sort of relationship and communications with families who are going from assessment through then into the review sort of in that 12-month later period, and for those families who are in that successive cycle of annual reviews, so that they have a really joined up approach from within a hub, and less transitional changes from our perspective. So we think that's a really exciting way forward. We are currently using the same mailboxes that we've used, so we've still got Send Assessment Hub and Send Reviewing Hub. Please just continue to use those as you have been. We've got some processes in place whereby we triage those and get them to the right hub, and we are looking at our processes to make sure we can get back to respond to those emails in a far more timely way. So hopefully that just gives you an update on where we are in the statutory Send team. Thanks, Kat.
Thanks, Gemma. And I'm just going to turn my camera off just to protect the connection, because we are expecting lots of people on this call, but we will bring cameras back on when we do the Q&A at the end. So I want to thank everybody for coming today. It's been a very, very popular training session. This is the third and final session that we are holding. They've been 3 identical sessions that we have held since Wednesday. And it all came about because of last May's SENCO feedback questionnaire, where we saw that real need from those of you that participated in that questionnaire, that you wanted to have some more training all about what makes good requests, about the process itself. And so that's why we are holding it today. And we did have to wait. It feels like it's been a long time coming, but because of the publishing of the new graduated response tool, which I'll talk more about in just a moment, we wanted to wait to hold this training until after that had been published. That's why we started with annual review training and training on tribunals. So some of you may already recognise, because you've already come to previous training sessions that I've held. Just on that point, this session is being recorded. You will also get sent all the slides, so don't worry about having to make too many notes. And we will be sharing a recording of this on the Somerset County Council corporate YouTube page, and do look out for a link on that, which will be coming up in SEN News in the next couple of weeks, so that you can find that video, because I know there's going to be a lot I want to say, and I hope there's going to be stuff you want to look at in a little bit more detail in your own time. Because we've got so much to get through, we've got 90 minutes. I anticipate I'm going to be talking for the majority of that time. There's probably only going to be about 10 minutes left at the end for questions. Because of that, I do need to be quite strict and say, please, can you make sure you're on mute throughout? Please don't ask questions during the presentation. I can't see the chat, so I'm not going to be responding to anything in the chat. And also, using a chat throughout the presentation can sort of sometimes start a little bit of a conversation, which then might become distracting to others. So can we not use the chat? But we are going to say that at the end of the presentation, when we do open up for questions, can we have all questions put in the Teams chat? Because then that means everybody gets the chance to comment or ask a question. And also, because we know there's probably not going to be enough time for all of your questions to be answered, it means that Gemma and I have a record of that question, because we've already set some time together next week where we will be going through and creating like a question and answer sheet, which we will then also send out to you. So just to repeat, no questions throughout the training, and save them all until the end, at which they'll be going into the chat. So what do we want to cover today? I've already touched upon, but I want to talk about how a request for assessment would be the next progression, if that was deemed appropriate, from the new Somerset graduated response tool that was launched just before the Easter holidays. And I'll be showing you some of the key aspects of that in just a moment. I'm going to be talking about what paperwork's needed for a robust request and exactly how we need you to submit that to us. I'll be talking about how we make those assessment decisions as well through our statutory send panel. Now, on that SENCO feedback questionnaire, a key theme was lots of you saying we want to see examples of quality requests. Can you show me what a good request looks like? So I've tried to pull out some examples for you to look at, and obviously you will want more time to look at those. So as I've said, rest assured you will get that opportunity by receiving the slide yourself. We'll talk about those decisions that are made as part of the request for assessment process, the decision to assess, and also the decision to issue a plan. And then also we're going to end by talking about our collaborative outcomes meetings, also known as our COMs. Now, with all the training I produce, I always do a dry run through with the SEN team, which I did right at the start of this week, to get their feedback and sort of to get any sort of final tips that they think, oh, actually, you didn't include that. It would be really great to share that with settings. And some of our team members are former SENCOs, and they raised some really great points. And I think it's important that I want to begin from the offset to really have that acknowledgement about today. Yes, I am going to talk about well-timed requests and requests that have some specialist involvement built into them through those APDR cycles. But in saying that, Gemma and I absolutely recognise the feeling that some, if not many of you have, about how long it might feel that it takes to get that involvement, and or how long it might be to access those health assessments. I'm going to talk a little bit more about that later on in terms of that specialist involvement and actually unpicking that. But I do think it is important to say, to start off by saying we do recognise that, and we look forward to your feedback about that at the end of the session in the Q&A, because if nothing else, training like this is such a great communication tool. Whilst I unfortunately don't have all those answers to fix everything, today I do want to share with you perhaps some tips and techniques that you might want to undertake in terms of empowering your class teachers, so that they can be ensuring that support beyond universal provision is well identified by them and quickly acted upon, because that might go some way to support that feeling of that extra support being delayed or well overdue. Now, for those of you, again, that have come to previous training sessions of mine, you'll know that I like to use Mentee as a tool just to get that baseline understanding. So if you're not familiar with it, if you can use Mentee either on your computer or ideally on your phone is a really great way to use it. So you go to mentee.com and it will ask you to put in an 8-digit code, which is 1962 2181, with the statement being to rate your understanding of what makes a quality request for an education, health and care needs assessment, with the score being 1 if you don't feel at all confident, to 5 if you feel very confident. So just bear with me, that code is going to reappear. It's back on the top of the screen in just a moment. Sorry for the delay. It is 1962 2181. Apologies, that was a bit slow. Must know it's a Friday. And you just click a score 1 to 5 and then hit submit. And hopefully, although mentee seems to be a bit slow, there we are. Some are coming in now. So absolutely be honest. There's no right or wrong answer. And I am going to ask this same question at the end of the training because it really helps sort of our internal processes just to know, okay, did we address the question about helping you understand that, or do we need to do a little bit more work? So thank you for those responses that are coming in. Brilliant. Okay, I'll just go back, but if you still want to submit a response, please do. Okay, so when planning this training, this quote from our Unstoppables was something I felt really meaningful to be thinking about the purpose of why we're here today. Because yes, we're going to be talking about the correct paperwork. Yes, we're going to be talking about APDR cycles, but actually it's really important that we don't lose sight of that big picture of actually what having an education, health and care plan means to those people with SEN that really need it. So that quote being, we want to be able to move through the world without having to force our way through it. And then just before we talk anymore, because some of these terms are going to come up in this training today about how we define SEN, how we define special educational needs, and the Children and Families Act identify that a child or young person has SEN if they have a learning difficulty or disability which calls for special educational provision to be made for them. A child of compulsory school age or young person has a learning difficulty or disability if they have a significantly greater difficulty in learning than the majority of others of the same age, or they have a disability which prevents or hinders them from making use of facilities of a kind generally provided for others of the same age. And when we're talking about our early years children, they would be classed as having a learning difficulty or disability if they were likely to be in this second subsection when they were of compulsory school age. So now looking at Somerset's graduated response tool, and I hope this is something that people are familiar with. This replaced the core standards, and it was launched through some very informative webinars just before the Easter break. If you missed it, I've got the links here on the page. This top link here takes you to the toolkit, and this link at the bottom of the page that takes you to a recording of the webinar. So all that information is there to access in your own time. So please do have a look at it if you miss this. Because in the next few slides, I'm going to be sort of picking out the key bits from the graduated response tool and show you how a request for assessment would sort of fit into that as the next step in the process. And I did ensure that I worked with people who were behind the development of this tool to make sure that, you know, that our approach is cohesive and well coordinated, so that, you know, it shouldn't seem that the two systems are in isolation. Now, I do want to say that the Somerset Graduated Response Tool, as it currently is a resource for statutory school age children. I know lots of you here are going to be from primary and secondary schools, but I do know we've got some early years colleagues on the call today, and some potentially from post 16. And I know your toolkits are in the process of being developed. But we did decide to pitch the examples, particularly when I show you those later on. They were all aimed at statutory school age, and the paperwork I show you is the paperwork that statutory school age settings will submit. So I just wanted to make it really clear, if you're here from an early years or a post 16 setting, please don't feel confused that your paperwork is slightly different. That's absolutely true. That is the case. And I know certainly for early years, because you've recently had your new service manager in post, we want to create some more bespoke training for you, which just acknowledges some of the slight intricacies of your request. So that is coming shortly. We hope. We need to get that date booked in very quickly, because I know that need is there. So rest assured that is coming. So the next few slides, as I just said, are going to pick out some of those key bits from the tool which are especially relevant to the messages I'm going to be giving in this training. So linking lots with section 6 of the code. So within this blue quotation box, so where a pupil continues to make less than expected progress despite evidence-based support and interventions that are matched to the pupil's area of need, the school should consider involving specialists, including those secured by the school or from outside agencies. And because section 6 is going into detail in terms of provision that would fall into SEND support, it should therefore be the case that specialist involvement should be sought prior to an assessment, but there's a little bit more to that, which I'm going to talk to you about later on. And then this pyramid model from the new toolkit replaces that previous semicircle horseshoe model that used to be in the core standards. So 6.44 of the code says that where a pupil is identified as having SEN, schools should take action to remove barriers to learning and put special educational provision in place through a 4-part cycle known as the graduated approach. So there we've got the code of practice recognises that that expectation that there should be that graduated response through those apdr cycles. In terms of where that graduated approach and where the graduated response tool fits in terms of making requests for assessments, well, the code's quite clear. So 9.3 of the code says that a request for an education, health and care needs assessment should not normally be the first step in the process. Rather, it should follow on from planning already undertaken. But it does say that in a very small minority of cases, children or young people may demonstrate such significant difficulties that a school or other provider may consider it impossible or inappropriate to carry out its full chosen assessment procedure. So I hope it's helpful to see that term, a very small minority. That's what the code's saying, is that on the whole, we should be expected to see that graduated approach, but there is that acknowledgement that in a very small minority of cases, that might not be appropriate. So thinking about, okay, what's an example of a very small minority? Well, it could be, for example, a child showing a severe sensory impairment, where without that immediate specialist intervention, there could be increased learning difficulties. Or another sort of particularly relevant example due to current political climates is the scenario of a child arriving at an educational setting from overseas, presenting such a high level of needs where the setting would feel they needed to act immediately to put a request in. Just another key point that the code's saying there is 9.16. Local authorities must not apply a blanket policy, though, to particular groups of children or certain types of needs, as this would prevent consideration of a child or young person's needs individually. So we can't be saying, no, all of these needs need to follow an APDR, for example. So the code is giving us very clear guidance and instruction in terms of that expectation for a graduated response in the majority of cases, but there are instances where that wouldn't be appropriate. And here we've got a new APDR, assess, plan, do, review model that's included again in that graduated response tool. So because the code is saying, yeah, in most cases, in the majority of cases, we are expecting to see those cycles as part of your evidence for your request for assessment, a lot of settings might say, okay, you're expecting to see them. Exactly how many cycles should I be doing? Is it just one cycle? Does it need to be 5, 6 cycles? Well, 6.44 of the code talks about successive cycles, which is not as clear as it could be. To me, my interpretation of successive is talking about at least 2, but beyond that, it's a little less clear, but you know, you can see there the code says successive cycles. Within your APDR cycles, we want to be seeing what those agreed outcomes were within that assessment stage of the APDR, so that we can also be trying to get a good appraisal on whether these have been reached. So making sure your target setting within your APDR cycles within that planning stage are smart is really, really important to being able to establish whether that target has been met. And just on that point, while I'm talking about smart targets, if you're not aware that Virtual School have got some great training packages all about smart targets. I know many settings have accessed that training since it's been launched, but that is there if you felt that that's something your setting needs a little bit more support on. So within a request for assessment, seeing those APDR cycles should help panel, and I'll talk about panel later on, they're the people that are making the decision on those assessment requests. It should give that better understanding of the child's needs, but also provide that additional information in terms of, so what is this request telling us about the child's needs and further provision beyond SEND support that you feel they need. And again, we can see 6.63 of the code, we've got that clear progression of moving from that graduated response to a request for assessment, because the code is being really clear where it says, despite the school having taken that relevant and purposeful action to identify, assess and meet the SEN of the child or young person, if they've still not made expected progress, then that's the point where a request for assessment should be considered. And it goes on to say really quite clearly, to inform its decision, the local authority will expect to see that evidence of action taken as part of SEN support. So when making a request, these are the forms you should be sending as if you're from a statutory school age setting. As I said earlier, we know early years post 16, your forms are slightly different. These should be sent to us via the portal. And I've said the word portal, and I'm going to say straight away, we absolutely recognise that there is a need for more training on the portal, that we are very much going to be planning into sort of the next academic year's offering of training. So we know it's an area lots of you struggle with. So please know that training is that need is acknowledged, and that training will be coming. So on screen, we've got a request for assessment. We've got the SEND support review, and again for statutory school age children, that's different depending on the age. So there's a different form for year 9 and above because it builds in that preparation for adulthood aspect. And there's also the parental consent form. It's mandatory that all Somerset schools use the portal to submit these forms. You can either complete them on the portal and populate them sort of as you're doing it on the portal, or you can attach a saved version of this form that you might want to complete in your own time, and also you can then be uploading your documents, your APDR cycles as evidence. If you choose to do that, then just a reminder, there's the link here for where you get these forms. The consent form, the reason I wanted to talk about and show the consent form is that it's very, very important to the request for assessment. The consent form needs to be hand signed, and it's also where in instances where parental responsibility is more complex, it's really important that as part of that request we can understand exactly who's signed that, exactly who's given their consent. So in those cases, just sort of adding a little note onto the consent form or somewhere within that request, just so we can understand who signed it, and just to have that good understanding on sort of that relationship and the complex aspects of that is very important to us. So again, if you've been on any previous training that I've done, you'll know that I always like to give you some data to provide that understanding of what does the SEN picture and the EHCP picture look like within Somerset, and also in the top two graphs to also have that comparison with national data. So you can see that data for England is shown with a blue line, and for Somerset it's in red. So the top two graphs show us that since the code was published in 2015, we've seen a decline in the number of pupils that are being identified as SEN support, and quite a sharp increase in those who are holding an EHCP, holding a plan, especially when we're talking about the past 3 years. And you can also see from the lower graph that currently, based on our most recent data for 2022, we've got we're maintaining about 4,300 plans in the county. I'm going to talk a lot more about 20 weeks over the next few slides, but whenever we're talking about a request being made for an education, health and care needs assessment, we're talking about a 20-week process, with the clock for that 20 weeks starting on the day that we receive a request. But this graph, as indicated with that blue line, shows us just how much that 20-week performance has improved over the past 2 years. So you can see, the data for 2021 showed that we're meeting 20 weeks over 60% of the time. If you compare that to the data for 2019, that was just over 20% of the time. So a huge improvement. I have to say, though, we completely recognise that that improvement is due to an improvement in performance across the whole SEN system, which has been a huge collective effort. So things like advice coming in more promptly, as settings returning consultation forms more quickly to us, our business support colleagues processing those requests as soon as they come in. We definitely couldn't have seen this increased performance as just a SEN team alone. So we want to recognise and thank you for that, for your support in doing this. And again, just bringing it all back to that big picture. Yes, 20 weeks and 20-week performance is something that our senior leadership team look at in terms of our performance management statistics, but really that 20-week deadline is there to ensure that children and young people that need that support get it within that time, so that's not delayed. So continuing on from that 20-week guidance, and based on the fact that that 20-week clock never stops, I thought this was a good point to remind people, perhaps even just to show you for the first time, this resource that was created by the Educational Psychology Service in probably only the past couple of months. It's fairly new. And what it does is it identifies potential conflicts based on when a request is made. And I've attached the link on the slide, which you'll be able to access, so you can have a look at it in a little bit more detail, because I appreciate it might be quite small on screen and you might want to spend a little bit more time looking at it in detail. Now, I talked about how it identifies potential conflicts and the timing of a request, but of course it's really important to say that of course a request can be made at any time, and the purpose of this calendar, this tool, is to be supportive and not to make you feel restricted about when exactly you can make a request. So I hope it is seen in that way. But just to give you a very quick summary of it, so looking at the colour coding, if we're looking at this sort of this jade green colour, which comes into effect at the end of May throughout April, so at the end of March throughout April and into the start of May, this shows the impact on consultations being sent over the summer holiday period. So if you made a request for an assessment during these times, then that means later on down the line, consultation forms would be sent during the summer holidays, which obviously is more challenging because you're likely not in those settings. And then here, indicated by this bright pink colour, if requests for assessments are made in these times, that means that educational psychologists would need to carry out assessments over the summer holiday period. Now, it's important to say these assessments would still take place, but because it's out of term time, that educational settings won't be operating, so those assessments would have to take place in home rather than at school. And very often that wouldn't then provide the optimum conditions for the educational psychologist to see things like how's that child or young person interacting with their environment, how are they in terms of dealing with their peers. The educational psychologist can't see those relationships with peers. It also prevents them from being able to ask a class teacher or any adults within that setting any questions about that child or young person. Please also be mindful about the timing of requests coming in for children that are transitioning to the next stage of education. So, talking about end of early years into reception, end of year 6 into secondary, and so on. There's a huge impact on making this request really any time from Easter onwards, because the 20-week date is going to fall within the summer holidays. It is the case we see requests coming in for assessment because there is a need that there's a feeling that a child or young person will not cope well in their new setting, so they need a plan to be put in place in order to support them with that. Well, on that, it's worth saying it might not be the case that a plan is necessary for that support to take place. There's lots of transitional support that falls within SEND support, but if that's part of a wider picture, it is really key that that request is made in good time, because if it's made at Easter or after, then that plan isn't going to be in place in order to provide that child with the support they need, because that 20-week deadline will fall in the summer holidays. And this all that talk brings us on to more of a wider conversation about, okay, so what are those barriers to quality assessments being carried out when a request is made? So I've already said that 20-week clock never stops, and I've said it in the 3 training sessions now, but I don't know why you would, but if you did care to submit a request on Christmas Day, that request would fall to exactly the same 20-week standard as a request that was made during term time. It's not the case that the clock is paused outside of term time. It keeps running throughout the school holiday period, which I don't always know that people realise, so it's just important to say that. So being mindful of when you're making a request based on the knock-on impact of what information is going to be then requested of you is really important. And so that tool, that calendar I've just shared, might also be useful in terms of your preparation in knowing what information I need to have ready, because it's going to be asked of me at certain times. When I planned this training, I worked with many different professionals involved in this area, and when I worked with Somerset Parent Carer Forum, they spoke very honestly about how relationships with families can be hugely impacted in a negative way by the feeling of schools and the SEND team perhaps working against them and blocking support that they might feel they're entitled to, which then obviously feeds into that sort of them against us mentality and the attitude that they feel they've got to fight for every decision. We have had experience which only goes to sort of further reinforce this to families of times when they have taken it to appeals, it's gone into mediation, and then schools have found more evidence that really should have been submitted as part of that initial request, which has then overturned the decision. But for those of you that came to my tribunal training in December, you'll know that, you know, once things get into that appeals arena, it makes those relationships with families really quite challenging, quite strained, and it's often difficult to get that positive relationship back. So that's all worth considering. But then on the flip side, I'm sure everybody here can think of instances where you felt families have just pushed and pushed and have been insistent on making a request that you didn't feel was yet ready or you didn't feel was appropriate. So I also wanted to acknowledge that and say that actually we hope that training like this helps to improve your knowledge and understanding of the process, which then can help to support your confidence in terms of being able to give families sort of answers to their question, so that you can be sort of informing them of what the next step should be and why you're choosing to make those decisions, so that they still can feel listened to and supported without feeling that they're not getting the support that they feel they need. So I talked at the start about talking about how decisions were made, and so that brings me on to thinking about our SEN statutory panel, and this is our panel who receive the requests for assessment, and they make the decisions based on whether or not to issue a plan, and even before that, whether or not to make an assessment. And as you can see from the table, it can include a wide range of professionals, and it's supported, the idea of having a panel is supported through the code, where they say that, you know, that might be helpful for local authorities to make those decisions. You can see from our SEND team, as well as having at least one manager, we also have our SAROs. That stands for our Senior Assessment and Reviewing Officers, and we also have our ROs, who are our Assessment and Reviewing Officers, and I'll talk to you a little bit more about those in the next few slides. Now, over the past year, as part of the written statement of action, we've had some SENCOs come and observe panel. And as part of the development of this training, I asked for some feedback on that, which I thought was really useful to share with you today. So from a secondary SENCO, they said that, in my opinion, attending panels should be part of all initial SENCO training, or failing that, I believe there should be a requirement that all SENCOs attend within the first 12 to 18 months in post, because the professional development I got by attending panel was fairly significant. It helped to fine-tune and clarify many areas of my ongoing SENCO knowledge, skills and understanding. A real point of learning for me was around the legal test, the May and May test. Alongside this, how section 6.63 of the code works in detailing the need for apdr and the requirement for the graduated response to be evidenced prior to submitting a request. So I've already talked about that 6.63 and the graduated response. I will come on to the legal test, that May and May test, shortly. And from our primary SENCO, who said, I'm not sure all SENCOs are aware that there are two panels for stage 1 and 2 decisions, and I think it would be helpful for them to know what goes on before it gets to panel. I think some SENCOs just think an RO makes a decision on their own. Seeing the lack of evidence within requests was shocking at times, even if it was a school request. Attending panel really made me think clearly about showing needs and provision on SEN reviews and when making requests. So as you can see from that feedback, there's that recognition that attending panel is a really great experience for professional development. And if it's something that you feel you would like to do, then the invite is there to come and attend panel, to observe it. It's always on a Wednesday morning, and if you do want to come and observe panel, it's a virtual meeting, it's held on Teams. Then I've put an email address on this slide for you to express your interest. But we also are always looking for more active members of panels, so SENCOs that can actually be part of the decision-making process. Obviously, there is a little bit of prior preparation that's needed for that, because you would have to familiarise yourself with the requests that are going to be discussed at panel that week. But again, that's another thing that we're always looking out for, because that again really goes on to make sure we've got a real well-rounded picture of people as panel representatives, and again is really supportive for your professional development. So as part of the panel feedback that I received, I didn't include on those two snippets, there was definitely mention of that, of there being support required surrounding EBSA or ABSA. Well, by that we're talking about emotionally based school avoidance, or ABSA's anxiety based school avoidance. And also Gemma and I, before receiving that feedback, that's something we'd already preempted as an area where settings feel that they need more support on, and really more support in terms of knowing how that would fit into a request when maybe you feel you can't get the evidence because that child or young person isn't actually coming into the setting in order to get that evidence in the first place. I just thought is worth just thinking though about, first of all, that thought about is a request for assessment and a plan, an education, health and care plan initially, or whoever isn't on mute, go on to mute please. Thinking about whether a request for assessment is initially the right vehicle in terms of getting the student the support they need. If it is, then as with all requests, we'd need to see that robust evidence. So thinking about evidencing what had been tried, any records of meetings, any conversations, any visits when they had come into school, into your educational setting, what had helped that. Now, provision on here can be built into your APDR evidence. So all the resources for this EBSA and ABSA give some ideas of suggested provision that you could try. So that's something that should be built into that APDR guidance, and that's the case for many other services. So on SSE, you've got resource pages for all the main services, and it includes resources for not just statutory school age, but also your early years and post-16 age ranges. Because, and this is what I touched upon at the start, across the previous training sessions, we've had people query, as we expected, the potentially long wait times for professionals coming into school to support you with that provision within your APDR cycles, and sort of thinking that because section 6 of the code is talking about that specialist support, that has to mean somebody physically coming into the building to support you. So using the resources and that suggested provision on SSE, and it's also reiterated through the SEN support resources on the Somerset graduated response tool. This may absolutely serve to be showing that strong evidence that you can provide as a setting. So building that provision into your APDR cycles to show that even based on that provision you've tried, that there's still a need. Yes, there's always going to be children whose needs is so strong that actually you do need people to be coming in. But if you can show through your own evidence that the need is beyond SEN support, then this would also be seen as an appropriate request. And just a final point on specialists coming in, it may seem obvious, but ensuring you're putting in place the suggested provision that specialists are saying should be obviously part of that APDR cycle. We do have instances where settings just feel it's a tick box. Yes, they've come in, therefore my request for assessment is automatically going to be approved. It's not the case. Obviously, you need to be putting in that suggested provision into those APDR cycles.
And they were drawing a picture. And they more about Unless she's done it.
Sorry, we still have somebody that's not on mute. Is it possible, please, to just check you're muted? Thank you. Okay, so the panel feedback, particularly from that primary SENCO, talked about the different stages of the panel. So let's just have a look at that in more detail now. So it's stage 1 panel. That's all about that decision on whether or not to assess. So panel members are looking at everything that's coming in as part of that request for assessment and making a decision whether or not to assess. Prior to that getting to panel, the RO, the Assessment and Reviewing Officer, will have offered an initial phone call with all families so that they can get that better picture of what life is like for them, so that they can find out what the aspirations are for that child or young person, and also to find out what do the families hope to get out of the process, so that can all be shared at panel as part of that wider picture alongside the evidence that's submitted with that request for assessment. From the date that we receive that request, we have 6 weeks in order to make that stage 1 panel decision and also communicate it back to families. It's really important to say that a request for assessment is not a diagnostic process, because the only new assessment that's going to happen at this point is an educational psychology assessment. And that, in fact, is only going to happen in the second 6 weeks if the decision at stage 1 panel is a yes to assess. Senior educational psychologists who work with me on this training, they also wanted to raise the point that the more assessments that come in, the more requests that come in for assessments, especially requests that might be of a poorer quality, they really only serve to dilute the impact of the educational psychology service, because they're having to be more thinly stretched in order to complete all these assessments, which is then at the detriment of them being able to spend as much time on completing all the reports. And also settings who feel that they would love an EP to come in to do some work with them as part of their SEND support offering, feeling that there's no availability, that's often a direct result of there being too many requests for assessments in the system, because the educational psychology service has to spend all their time working on assessments rather than anything else. I'm going to talk about it a little bit later when I talk about the decisions at stage 2 panel. But the SEND regulations say that we must seek advice from quite a prescriptive list, which I'll share with you later. But that term, seek advice, doesn't mean there's necessarily going to be any new assessments, especially for services that don't already know the child, because they might simply say, when we seek advice from them, they might simply respond with, this child isn't known to us. Therefore, it's crucial that the request that you provide us shows that robust evidence of everything that's been tried. So using that provision on SSE, so to show that you are through your APDR cycles demonstrating that need is beyond SEND support. So being really thorough at your end, so that we're not reliant on having to find new information when it comes to panel. So in terms of requests coming in from parents, when that happens, you as settings should be able to provide all of the information you have in terms of what support that child or young person's had through your APDR cycles, any other evidence you have, or also your evidence of how you feel needs could be met through quality first teaching and SEND support. Because if you're not in support of a request, please tell us, please show through your evidence that actually you feel needs can be met through SEND support. You've just heard me say the impact of us doing assessments for children who don't need them massively impacts on those that do. So So please, be logging any of that interaction with parents so that you can give us all of that information, so that we can be getting that really clear picture of the child and young person and an appropriate picture of their needs. So the secondary SENCO, they talked about that legal test, that may test, which is what stage 1 panel is making their decision on. So that legal test is the local authority must assess where A, the child or young person has or may have special educational needs, and B, it may be necessary for special educational provision to be made for the child or young person in accordance with a plan. So it's a 2-part legal test. So for part B, we really need to see your evidence to support that special educational provision needs to be made in accordance with a plan, or conversely, if it's a parental request that you don't agree with, you don't feel a plan is necessary, your evidence to show how you feel needs can be met without one. And when that term special educational provision is referenced, we're talking about provision that's above that which would fall into universal provision or SEND support. If you came to the tribunal training that I delivered in December, you'll know I talk lots about way forward meetings as being a good tool to try to preempt things getting in the appeals arena. And I would certainly echo this for decisions following stage 1 panel that are a no to assess, where a way forward meeting could be called, and we absolutely welcome you initiating that, saying to us, can we have a way forward meeting, especially in circumstances where you feel that the family is really going to struggle with that decision. And just so you're clear, if you're not aware, a way forward meeting is in essence a meeting where you know there's an obstacle and you want people to get round a table, even though that might be a virtual table, to really sort of support that discussion in terms of how we can move that situation forward. So it might include families, an assessment and reviewing officer from our team, or a senior assessment and reviewing officer, and also yourselves to really just talk through that decision. Another point that the team raised when I shared this training with them earlier on in the week was that acknowledgement on, because of panel falling on a Wednesday and our internal processes, we have quite a sharp turnaround within which we need to be communicating that information back to families and to yourselves. And if you're class-based, or if you are in an early year setting and only have certain time where you have allotted to your SENCO release time, it might be that we are always emailing you that response because we haven't been able to catch you on the phone. And obviously an email doesn't fully convey sort of the richness of the information in terms of how a decision was made in the same way that a phone call has. So if you feel ever that you've received something via email, particularly when it's a no to assess decision, that you feel you'd like to talk through with our team a little bit more, but you haven't been able to catch us, please do follow that up with an email to say, I'd love to talk about this more, I'm available this and this time. Please send that back to us, and we absolutely will make time to have that conversation with you in person, because again, that increased knowledge and understanding can only serve to really support families in understanding that decision better, and obviously supporting yourselves in understanding that decision. So coming on to those request examples, and I said that was a real theme that came from that SENCO feedback questionnaire, where you said you wanted to see some good examples to help you in your own professional development in terms of putting in good requests. Now, I know it is easier said than done, because obviously no one request is the same, but I have tried to pull out some different aspects of paperwork that might be completed. And I work closely with Fee Turnbull from the virtual school in doing this to ensure that the examples I were giving you were going to be useful to you. So I hope they they are useful, and obviously they might appear on your screen a little bit small, but you will be sent this, as I've said now, so that you can enlarge them and have a look at them in more time, because I appreciate I will be going through them quite quickly. As I said in the introduction, I'm a former teacher, and I know it's often those children with SEN are the ones that keep you awake at night, that you just constantly thinking about them. You could write dissertations on them. You know, your understanding of that child or young person is so rich. We as a SEN team and those that are on panel, we don't know anything about these children and young people. We know nothing about them until that request comes in. So really the challenge with your request for assessment is really trying to get across and capture that clear picture of the child's needs, so that you can help us understand why you're pursuing that assessment, how it shows that their needs are beyond that would fall within SEN support. So I'm going to start with this example, and this is what the school had provided in terms of what provision a pupil had had. Just to give you a bit of background, this was a parental request, and then the school submitted their evidence as part of that. And actually the school weren't in support of the request. They felt that all needs could be met within SEN support. The reason I'm showing you this one though is because it really tells us very little, and actually the school, I feel, could have provided a bit more detail, even on the sheet itself, this sheet itself, to show their point of view. We don't know any information in terms of how often this provision took place, the ratios that were involved with this provision, any outcomes of this provision. So I think it's really important, and the reason I've shared this one with you is that we need to have that ability when we're saying no to assess, to really be able to back up how we can be showing that all of this can be met within SEN support. Because it might seem a little bit contrary, but if you think that you're helping us when it's a request you don't agree with by not providing as much evidence, that actually can cause more problems later on down the line because of that, the ambiguity of that legal test using the term may. So we need you to be just as thorough with your paperwork in evidencing how things can be met within SEN support, just as much as you would when you're putting in a request because you need you feel that a higher needs funding is necessary. You saw me show you earlier that we need to see a SEN support review as part of your request for assessment, and here we've got example A. Now, as I said, it's hard to look at it clearly in the time that I'm going to give you, but what I want to pull out from this one is that I don't think anything here within the needs section is beyond SEN support. And also, and yes, I know the paperwork can be a little bit ambiguous because that word needs could sometimes be misunderstood to be including information about what the child needs, but actually then that would be a provision. And here you can see in this lower section for social and emotional, this here is a provision, that's not a need. So really making sure that you're putting the correct information in the correct section is really important. And on that, I thought this was a good resource for you to have. So it's got need, outcome and provision. It's got a definition of each, and it's also got an example. So you can just be checking back if that's something you feel you need a little bit better understanding on, and also just to re-highlight that outcome and provision within your apdr cycle should be written using SMART targets, and so these give you examples not only of an outcome and a provision, but one that is written using SMART targets. So that was example A of a SEN support review. If we now compare it to example B, you can see, although it is quite small, but I can assure you that we get a much clearer picture of this child and their needs from this SEN support review. And that detail helps us to understand more of the impact on that child or young person when their needs are not being met through that provision that's being put in place through those APDR cycles. I must just say though, when I'm showing you a good example, I must caveat that I'm not talking about this in isolation. So just this would be enough to be taken to panel. I'm talking about this as a good example alongside other evidence through that paperwork. So just wanted to make sure that's clear. So now coming on to sort of bits of extra evidence that you attach as part of a requestment, and lots of you include things that we'd sort of describe as pupil passports, and you can absolutely use your own school formats for this and just upload it as an attachment within your portal forms. But here, example A, again, I hope you can recognise this really tells us very, very little about the child or young person. And as a panel member who knows nothing about them, it's quite difficult to ascertain very much at all from this example. By comparison, this passport, and as I say, as part of a request with those APDR cycles and that SEND support review, helps us to understand more clearly the strengths, the needs and the experience for this child. And just to pull out some of the particular information on this, I can see up here that this child is a very able mathematician, but we can see that there are some huge SEMH barriers that are getting in the way of that, them being able to sort of realise that potential. So then coming on to your APDR cycles, and just a reminder that the code is saying there's for the majority of children expecting to see successive APDR cycles. So example A, this was a real example. Obviously all these examples have been anonymized, but this was a real example. And we again can gain very little insight into this. It's hard to see what the agreed outcomes were because we don't have any smart targets. And the assessment stage of an APDR cycle is so useful to us in terms of building up that understanding of the pupil. We can see here that reference to, okay, there's some socio and emotional mental health needs, they're getting upset, but really through a robust request, we want to be able to understand, okay, what does that being upset look like for that child or young person? How often does that happen? Has this always happened, or has it been a more recent thing? What's the impact of that on the pupil? So all that richness of information should be included as part of that assessment request. And also on here, we can't see any sort of outcome based on those interventions because we don't have a review section completed. If we compare it to this example, look at the wealth of information that this one is giving us, which of course you are going to want to look at in more time and enlarge it. I do appreciate it is a little small, but to try and just to summarize, we've got smart targets within this outcome, and so we can see the impact of that provision on the child or young person. I would just say though, if I was going to go back to sort of my teaching background and that marking policy of an even better if, one point I would include that's really important to panel, particularly because when we link it back to the children and families, that definition of SEN, which builds into that that comparison of pupils with others, with their peers. The terms developing, emerging and secure, and also the term working towards, can actually be a little unclear for panel members to get that real picture in terms of attainment levels, in terms of true attainment. So if you're saying this child is working towards year 5, please make sure you're explicit in terms of that true attainment. So is that working towards year 5, but actually they're operating at a year 3 level, or are they actually operating at a reception level? Because you see from that example just how clear that is, and how helpful that would be to a panel member in terms of sort of really understanding that true picture. This is the same APDR. This is just the second half of the sheet. We've got the child and young person's views here, and the family's views, which is so important because, as we know, that they should be at the heart of those APDR processes in terms of suggesting what provision they feel. So it's really important that we have their viewpoint there. And also we've got a review completed so we can see all that. And I believe this was one of at least 2 APDRs that were submitted as part of an assessment request, and each were as detailed as this. So really thorough paperwork which helped support panel in terms of their understanding. So just 2 final examples in terms of the timing of requests, and also don't forget earlier I talked about how you might not necessarily need that specialist provision to be coming into the building in order to start those APDR cycles. But here you can see there's that mention of recently requesting information from teachers, because this was a secondary school pupil. And also we've got a referral to speech and language team that's awaiting, and also awaiting to hear back from autism and communication. This request was put in, I think, sort of around about mid-December. But just going back to what I said, you know, looking at this, I would say that this child was in the middle of the APDR process, in the middle of that graduated response. But if you felt actually, but I'm waiting too long for these referrals, then be thinking about those suggestive resources from the relevant services on SSE, and start to be putting that into your APDR cycles, almost as a bit of a stepping stone to get that robust evidence from yourselves. If we compare it to this example, you can see we've got 5 cycles of APDR. I mean, the code doesn't say as many as 5, it says successive. You might not feel that you need 5, but that just shows that we've got more than one. And also this one just highlights what I was talking about in terms of that real attainment level, so that panel can really understand where that child or young person is working at. So here we can see they're in year 3, but working at reception level. So this request has been really clear in that sense. So a further measure that's being worked on, which we hope many of you will find supportive, is going to be a checklist of submission criteria that you might want to use when making a request. And you can see that the code does support that. It says that local authorities may develop criteria to help support assessment requests, but it goes on to say we must be prepared to depart from those when there's compelling reason to do so. So this is not the case that everybody needs to complete this as part of their assessment request, and it's certainly not the case that you need to have ticked everything off. It again is just guidance that we hope some of you might find supportive. There's a working group in process on this, which includes members the SEN team, the virtual school, parent carer forum. The view is that we're going to have an update on this at the next SENCO forum meeting, but we anticipate this will be ready for the new academic year. And it just, again, we hope that this is a supportive resource for those that want to use it, but it is by no means something we want you to feel restricts you, and that you're bound by whatever is on this checklist. So going back to the graduated response tool, there's some really great resources on it, and I've included the link on screen again to really support not just SENCOs but also class teachers with understanding of what exactly constitutes universal and SEN support. And this tool, this is a sort of a tracking tool to look at universal support. It has the option here to be logging when something was started, and some notes can be made on this in terms of end dates and reviewing and next steps. this is something that your class teachers should be doing. So the graduated response tool is not just for SENCOs. If you feel that your class teachers don't know anything about it, please do highlight that to them, because this is, as I said in the opening, this is a way where you can be really empowering them to make sure they're confident with their understanding of universal provision, so that they can be quickly identifying those young people that fall into SEND support, so that then the next steps can be accessed more promptly. And this is another resource. Again, this should be completed by class teachers. This is that initial cause for concern form, where those early concerns can be flagged. And if this is completed, then we would absolutely want to see this as part of your evidence for your assessment request. So moving on to your SEND support provisions. So when I sat in the webinar, I was initially confused about why these sheets didn't have that same ability to be making notes on them as the universal provision did on, in this example. And the reason being is that then this should be backed up with your apdr cycles. Because as you saw me show you earlier, just highlighting what's happened does not give panel enough information. So we want to see any strategies that have been undertaken through SEND support, and you've got lots of your resources from your specialist services within these provision sheets, and there's one for each area of need. That would then inform your apdr cycles, and you might recognize this as being quite similar to the example that I showed you as a really strong example of an assess plan do review form. The reason being is that those people that developed the Somerset graduated response tool, they used examples of best practice that was already happening with our Somerset SENCOs to inform their paperwork. So if you were sat looking at that earlier example thinking, well, our apdr paperwork does not go into that detail, I'm going to need to rewrite it and change it, that resource is already there. So that exemplar template is within the graduated response tool resources. So that might have saved a job if you felt that you needed to change your paperwork slightly. Okay, so Stage 1 panel is all about yes or no to assess. Everything that is yes to assess comes back to Stage 2 panel. And within this panel, the decision is all about whether or not to issue an education, health and care plan. This is the comprehensive list that I touched upon earlier that the SEND regulations give us in terms of who we should be seeking advice from if the decision at Stage 1 panel is yes to assess. But just to remind you again that seeking advice doesn't necessarily mean any new assessments. And all those coming back to Stage 2 panel for that decision to issue has a slightly different legal test. So where in the light of a needs assessment, it's necessary for educational provision to be made in accordance with an education, health and care plan. So the assessments that may have been gathered following Stage 1 panel, those assessments may show that all provision is seen to fall within universal or SEND support. So it's even more crucial that your evidence within your apdr cycles really go to demonstrate that need is beyond that there is need for that special educational provision beyond what can be offered within SEND support. Now, in terms of this guidance at the bottom, talking about this decision, whether or not to issue, needs to be communicated within 16 weeks of that initial request coming in. Well, actually, the code is talking about 16 weeks if the decision is no to issue a plan. we have to make and communicate that decision if it's a no within 16 weeks. In reality, though, if the decision is a yes to issue, because of everything that still needs to happen in order to finalise the plan and meet that 20-week deadline, we simply wouldn't have enough time to do it if we left that decision to 16 weeks. So in reality, we're actually making that decision around about the 11 to 12-week mark. And this now brings me on to talking about collaborative outcomes meetings, or also known as COMs. They began last year as quite a small pilot. Some of you might know about them. Some of you here might have been involved in a COMs, but I know there's going to be lots of you that have got no idea what a COMs, what a collaborative outcome meeting is. So I would like to play for you a recording of Claire, who's one of our assessment and reviewing officers, who's been a great advocate for our COMs process, and she's going to tell you all about them.
Hi, my name is Claire, and I'm an assessment and reviewing officer, RO, within the SEN team. A collaborative outcomes meeting, or COMS meeting, is where the RO, the EP, the family, including the young person ideally, with any other professionals and representatives from the educational setting, will write key aspects of the EHC plan together. This is normally scheduled within 2 weeks of the decision to issue panel date. You can expect the meeting to roughly last around an hour and a half. The arrow will be the one generally that sends out the invitation to the comms meeting, and they will have already pre-populated information onto the comms meeting pro forma, where they will have taken advice from any professionals that have written reports, and this will be attached into the file section of the comms meeting invite, so that all of the invitees will be able to see the information, have a chance to appraise the information, and suggest any outcomes or provision that they feel is necessary to add into the comms meeting discussion. So what's the rationale and the observed benefits of this process? Co-producing the outcomes and provision sections of the plan means that all parties can be involved in the plan writing process. And my experience tells me that this creates a really meaningful process for the families. It promotes a collaborative and open forum in which to share any potential concerns or queries, and therefore everyone takes ownership of that plan around the young person. And it also means that the young person and the family are part of the process rather than having the process done to them. And it reduces the arm's length relationship with families, whilst the process of them jointly agreeing outcomes and provision with the setting enables families to feel just so much more confident in the fact that their child's needs can be met within their local school. It's also anticipated, and is generally the case, that actually there should be fewer amendments made to the draft plan, because the families, like I've already said, will feel confident that the needs of their young person are going to be met. And settings are also clear on what provision needs to be put in place. And the hope is that in turn that this should therefore reduce the number of appeals or families being unhappy or surprised when they receive their plan. And the same can be said for the settings too. So the meeting itself. The EP will facilitate the meeting while the arrow will share their screen and the document and input the agreed outcomes and decision for provision being discussed into the document in real time throughout the meeting. The RO will emphasise the need for outcomes and provisions to be as smart as possible, and this is crucial to allow settings to monitor the young person's progression through the long and short-term outcomes, keeping the EHC plan a correct representation of that young person. The EP will normally have suggestions for the outcomes and provisions already prepared, and this hugely supports the time management of the meeting and keeps everyone focused in what actually can be quite pressurised in an hour and a half to get all the information and discussion complete. Now, if the decision is made previous to the comms meeting to not issue by the local authority, the comms meeting does still take place on the scheduled date as planned, with all the attendees present. This gives the opportunity for families and settings to discuss the way in which the young person's needs can be met, but without the EHC plan. And again, to help families feel confident in the support that their young person will receive from their setting. After the meeting, the RO will ensure that everything is typed into the provision and outcomes and that it's really specific and appropriate. And then the draft will go through internal checks and be sent out. And the aim is that due to the successful comms process, there should be very few changes required to the plan, if any. So in conclusion, I can say with complete confidence that the comms process from my perspective has been entirely positive, and feedback which I've encountered has echoed the same sentiment. It's empowering and a positive process for all parties, and I really look forward to this process becoming embedded moving forward.
So some great feedback there from Claire, which is also echoed in feedback from various people that have been involved in comms. So from SENCO, the collaborative side of having a range of professionals and parents at the same time to have discussions worked well. It meant there were no surprises on the draft plan. From a parent, the meeting's been helpful as I don't always have time to find out what's in place for my child. It's been a big help in being confident in what's being done for her at school. Another parent, it was a really helpful and collaborative meeting. Normally you just get paperwork shoved at you, but we really felt part of this process and it was nice to be able to have a voice. And finally, from an educational psychologist, the RO was brilliant at ensuring our outcomes were smart and that our provision was specific, which I found super helpful. The provision ended up being briefer, but much more targeted. I think we ended up with a much better set of outcomes and provision than I could have written alone. Claire touched on that comms will still happen if the decision in stage 2 panel is a no to issue. And even though this feedback here doesn't capture that, we have also been receiving really positive feedback from those that have been involved in those no to issue comms meetings, which is an excellent sign. I know we're really short for time and I could have spent a great chunk of this training just talking about the 20-week process itself, but to briefly summarize, so you've had stage 2 panel with the decision to issue. For those that are a yes, there's still a lot that needs to take place following that decision. Although, as you just heard Claire say, for those that go through to comms, and we are hoping that in time that will be all those that are yes to assess will have a comms, but it's obviously something that needs to be built up. But because of the comms process, we do anticipate fewer changes happening in the draft plan that's sent to families, but they are they do need to have up to 15 days to be able to respond to that. But as I said, hopefully comms will reduce that need for any significant changes to be made to the draft. Then we send out our consultation forms, sending that out to settings. So you can see how and why it's just so important that we hear back promptly from settings, while still ensuring that you are giving us detailed responses on those consultation forms, because they do become just so vital further down the line should an appeal be lodged. The final plan is then issued within that 20-week deadline. If at that point we still haven't completely confirmed the placement, we can still issue the plan, but with a holding line within section I, which gives you the setting. So it might just be the case that we put a holding line, which could be within a mainstream setting or within a specialist setting, and that absolutely does support our ability to make those 20-week deadlines. That's everything I want to say, and I do know we're short on time, so I just want to take you back to mentee. Apologies, my screen's a little bit stuck. To re-answer that same question on how you now understand the process. I'll just take it onto the next slide. So again, same question, to rate your understanding of what makes a quality request for education, health and care assessment, with 1 being not at all confident to 5 being very confident. So thank you for those responses that are coming in. And then I'm going to stop sharing and ask you if you have any questions to put those into the chat, so that we can then be using the time that's left to answer those. And I will stop recording as well in case anyone's concerned about